Hi, I'm Dr. Chris. I'm a practicing chiropractor. I'm the founder of Muscle Care. I see 55,000 patient visits a year in my practice. We understand pain. If you or anyone in your family or friends love to swim, give them this mini series of stretches. It'll help them a ton. And you know what? Swimming is great. It stretches you, it strengthens you, but you know what? If you're twisting your head always to one side, you are going to have some issues. So let's prep before and after we swim so we can enjoy it the most. The Super 6 rules to stretch are: warm up, be gentle, no sharp pain, breathe, always do both sides, don't bounce, and always hold for at least 30 seconds or until you feel the muscle relax. Now that you're warm, let's do these stretches and let's really have a fantastic day in the pool. For an effective side of neck stretch, let's keep the feet shoulder width apart. The pelvis is square to the ground and your hips are right under your shoulders. Your ears are over top of your shoulders. And all you're gonna do is keep your nose straight ahead and tilt your right ear to your right shoulder. Do not let your nose point down. The nose stays straight ahead. You're trying to get 45 degrees. And remember your Super 6 rules. You're gonna do the other side the same way. For the back of neck stretch, stand, feet shoulder width apart, pelvis square, slight pelvic tilt if you'd like, shoulders over the hips, ears over the shoulders. And now, in order to get the back neck muscles, what you'll do is simply rotate your face to the right, keeping the jaw parallel to the ground. And again, go to comfort. If there's any sharp end feel, back it off a little bit. If you feel dizzy, back it off and do less. Go into your side stretch, ear to shoulder. Do not let the nose tilt down. Keep it straight ahead. And then rotate the nose up to the left. You'll stretch the front of the left side of the neck. If you want more, hold your arms behind you for more stretch of the connective tissue of the front of the neck and the anterior chest wall or the front of chest. Do the same on the other side. Now, for the front of leg or quadricep, we call it stretch. What you want to do is you want to make sure that you're standing holding a wall with one hand, the right hand, and then you'll pull your left heel up to your buttock and you'll grab the front of the ankle on the left with your left hand. Try to hold that foot and heel as close to your left buttock as humanly possible, and that's when you go through those Super 6 rules of stretch. Now remember, again, this may be tight and you may not be able to get it all the way there. It's not essential that you touch your heel to your buttock, just as long as you feel the front of leg stretching. Do both sides. Once we want to do our hip flexor stretch, we can roll directly from our front of thigh or quadricep stretch. We can put our right hand on a chair for support. And all we do is, as we want to stretch our hip flexor, it's important that we try to pull our left leg back. So the left thigh, you're trying to get it closer and closer to parallel to the ground as you hinge at your waist and you move forward. So when your body is really doing this well and your hip flexors are stretched out, you'll be able to make a T. Your right leg is on the ground, that's the bottom of the T, and your torso and your left thigh create the top of the T. A fantastic hip stretch is called the figure 4 or lower buttock stretch, and that's where you lie flat on your back and you'll bend the knees approximately to 90 degrees. The feet will be flat on the floor. Let's say you keep the right foot flat on the floor. You lift the left knee up and you move the back or outside of the left ankle over top of the right knee. This creates a figure 4, and then you reach your hands through the space between the two legs, and the right hand goes on the opposite side or the outside of the right leg, and then you keep your head down and you pull up so that you're pulling your right knee up, but that's exerting a leverage or a force on the left hip and the posterior gluteus muscles called the piriformis. Now, reach around out front. Put the left hand on the back of the right one and push away from you, but do not round out. Stay straight. Open those muscles up in the upper back. Stretch them. Keep the head straight, ears over shoulder. 5 to 10 seconds. Repeat that 5 to 10 times. For the tricep stretch, it's really important that you stand with your feet shoulder width apart and you keep the ears over the shoulders, shoulders over the hip. The right arm reaches up, bends to 90 degrees over the back of the head. Still keep the head up. Many people want to drop the head forward. That's not what we want to do. Reach up with the left arm, grab the right elbow, and pull to the side, okay? Pull over to the left side. Stretch the armpit and the back of the tricep on the right side. And if you lean more to the left, you get more latissimus and tricep stretching at the same time. Make sure you do both sides. To stretch effectively the front of the shoulders, we can grab our hands behind us, lift the hands away from the body, and reach back and up, holding for, again, 20 to 30 seconds, opening the front of the chest and shoulder girdle. Do not let the head drop forward. Keep the ears over the shoulders and then relax. For the lower chest stretch, the right arm, for example, has to go 45 degrees above the horizontal. So it reaches up, making sure that the palm of the hand is held onto something tight and strong like a wall or a post. And if you can actually extend the wrist or the fingers backward while you do that and turn your body away from that side, including the head and neck, you're going to stretch all the connective tissue of the chest and the neck that all work together. To stretch the upper chest fibers, your arm would point down at 45 degrees away from the body. Hook the fingers on a wall or a post. Let them go backwards. Open up that connective tissue. And then turn your face and upper body to the left, away from the side of the upper chest fibers you're stretching. Let's sit neutral or stand neutrally, ears over shoulder. Let's not slouch. And let's gently open the mouth as wide as we can without pain. And hold that for 30 seconds to reduce masseter and temporalis tension at the side of the face. What happens when we look down at our phones all day, we actually retract and pull our jaw backward. We create a lot of tension behind the jaw, around the ears, again, blocking blood flow, blocking lymph. So what we want to do is we want to sit tall or stand tall, ears over shoulder, and open your mouth, and slowly but surely protrude the lower jaw out, again, to the point of comfort and a nice gentle stretch for 30 seconds, and then relax. This may take a few reps. This particular rotator cuff stretches on both sides. We start by getting our arms parallel to the ground, okay? Our upper arms or humerus parallel to the ground, elbows bent to 90 degrees. Try to get your hands back, and then you rotate forward, keeping the arms parallel to the ground. Do that stretch for 30 seconds, and then repeat it again. For the wrist extensor and flexor stretch, hold the arms straight. Make sure the elbow is locked. Push the wrist down and use the other hand to pull the forehand toward the body. Keep the fingers straight. Maximize the stretch through the entire extensor surface. Hold that until the burn goes away or that stretch goes away. Then, to stretch the flexors, just simply keep the arm straight, pull the fingers up, push the palm as if it's going forward, and pull those fingers back toward your shoulder. Hold that for 30 seconds, or at least until the burning in the bottom of the flexor muscles go away. Sit torso 90 degrees to your legs, both legs straight out in front of you. So if we can take the legs out to a V shape, we can actually get the inside groin or adductor muscles and the hamstrings to stretch together. Just lean your palms onto the floor and glide out between the legs, keeping the body hinged at the waist, not rounding out. For the standing shin stretch, if you've got knee problems and you can't kneel, this is a great stretch. Stand holding a wall, have a chair, have a couch behind you. Keep the one leg, the balanced leg, perfectly straight. Stand up nice and tall. Bend your other knee to 90 degrees. Open the ankle up and get those toes of yours, the top of your foot, on a couch or a chair. That's going to open up the front of ankle. And then what you can do is you bend the supporting leg a little bit if you want to lower yourself down and put more torque, more stretch on those front of shin muscles. That's a great stretch to prepare for walking, running, and any sport going. To do the supine or lying on your back groin stretch, lie flat on your back, arms straight, palms on the floor on each side for balance. Bring your knees, bend them at 90 degrees, keep the feet flat on the floor, touch the knees together, and then let the knees fall out. And if you can just let your ankles roll with it so that the bottoms of the feet touch together and the legs go out, that will open the groin tissues and the hip flexors somewhat. It's a great stretch, especially for those that skate or do hockey, that sort of thing. You feeling better? I knew you would. Listen, why don't you continue your pain-free journey by clicking the link in the description below and access my full stretching series and share the relief of pain and stress with friends and family. And you know what? If you really want to feel even better, why don't you try this? Muscle Care is the new sub-topical, all-natural, evidence-based pain, spasm, and inflammation reliever. You're going to love it. It's easy to use, simple to put on, no mess, no fuss. It's a roll-on. I'm Dr. Chris, and have a great day.